Hello, I'm Dr. Geraint Preest. I'm BMJ on Examination Primary Care Editor. We've had a lot of visits to our revision page where we give some feedback on one of the 2016 exams, and lots of comments arising from that. And we thought we'd give you, with just 2 months to go to the next AKT exam, a few tips to help you to focus your revision. These are general AKT revision tips, and they're areas really where candidates sometimes fall down and perform badly, and it may help you with your revision. So the first thing I'd like to say about this exam is that they're testing you on common things. Remember that this is a GP exam. The purpose isn't to test you on the rare fascinomas, the unusual things. You will see less common things if they're very important, or if the consequences of missing a diagnosis are disastrous. But generally this is an exam that's focusing on the primary care scenario and common problems. Unusual things crop up, such as meningitis, if the consequences of missing a diagnosis are important, so you will see those, but obviously it's going to be mainly common things and GP related things. Remember again, it's a primary care exam, so do nothing is sometimes an option. Very often when we see our patients in real life clinics, we're not always prescribing a drug or performing a procedure or making a referral. Sometimes reassurance is all that's required, and it's the same thing with the AKT exam. The examiners know this, and they want to make this very relevant to primary care. When you're sitting in examination setting, there's always a temptation to feel you should sort of answer with a prescription or answer with a referral or something, but that's not necessarily the case with the AKT. So remember, do nothing is sometimes an option. When you're answering your questions, answer them from the perspective of consensus opinion and national guidance. They won't test you on areas of controversy. So if you've got big areas of national guidance where there are conflicting views, it's very difficult to set questions in those areas. So generally the answers will reflect consensus. So remember that when you're revising. Your exposure as a registrar to various aspects of medicine is also important, and exposure to certain clinics has changed, certainly since I was a registrar, and candidates often perform badly in areas where they have less exposure to certain clinical topics. Now I'm thinking with these of clinics perhaps where duties are delegated to nurses or other healthcare professionals. Examples would be antenatal clinics, diabetes clinics, asthma clinics. Remember that the asthma guidance has recently changed and you need to update your knowledge on that. But I would also focus your revision and look for gaps in your knowledge, and maybe ask your trainer whether there are any clinics at the surgery that you can sit in on, whether you can sit in on a diabetes clinic or an asthma clinic to improve your knowledge. Candidates often perform badly here. The other area where candidates perform badly is in relation to administrative questions. Questions about filling in forms, reports, that sort of thing. Again, it's an area as a registrar where you may get less exposure. So it's worth asking your trainer if perhaps you can sit in on a session when they're filling in medical reports, or they're filling in DS 1500 reports or death certificates or anything in relation to the Department of Work and Pensions. Sit in on those so you increase your knowledge, because candidates often perform badly in that. A rich hunting ground for revision, and I've said this many times, is the BNF. Now the BNF is a large and fairly academic tome, and it contains all the information that we use every day for prescribing drugs and doses and what's relevant and what's not. But remember that in the BNF, in the first few chapters of the BNF, there are really useful areas looking at prescribing in palliative care, prescribing in patients with renal problems, prescribing in children, prescribing in the elderly, emergencies in primary care. This is rich hunting ground for examination questions, and it's a good area to revise because you'll get a lot of information focused in that area. As a revision resource provider at BMJ on Examination, we give you lots and lots and lots of questions, and it's obviously important that you practice lots of questions to get really slick. Don't go into exam never having seen a question before. You should practice these all the time. When you're sitting your questions, remember that the distractors in the question are there to make you think again, to think twice. They need to be plausible. And examiners are very much aware of this when they're writing examination questions. So if you're sat a single best answer question, you'll be given a lead-in and then there'll be 5 possible answers. 1 will be the correct answer, 4 will be less correct. Now this is an important distinction. Examiners are not necessarily looking for 1 correct answer with 4 incorrect. They may be looking for the best answer. So there may be several options there that are possibly correct, but for the given scenario, there will be 1 option that's better than the others. And remember that, because we get a lot of feedback from candidates at BMJ on examination that get confused by this and distracted by some of the distractors and argue, well, the answer is option B, but it could be option C. Option C is correct in certain circumstances, but the key point is that it may not be the best answer in this circumstance. And one of the best ways of not getting confused with that is to cover the options before you select your correct answer. So look at the lead-in, look at the clinical scenario. Before you look at the options, think, what would I choose? What is the best answer here? And if you see that amongst the options, then you're probably right. If you look at the options first and think, well, which one may fit in, you may find that you're getting distracted by some of the incorrect ones, because again, they're not always incorrect. They're just less appropriate. So with 2 months to go to the exam, I hope that's useful for you. We'll be posting more videos and more tips. There'll be more blogs, there'll be more written information, there'll be more feedback on questions. We've got our question writers writing questions. Right now they will be posting based on previous examination questions and feedback, information that's in the public domain. So look out for that, and I hope you found this video useful.